Hey, good morning, everybody. It's Manny Mustakakis coming to you from my house in Long Island. And this morning, I just wanted to take a couple of minutes and talk about a syndrome called broken heart syndrome. In the lay terms, it's got a scientific name, but basically, it's a condition that develops when people have sudden extreme emotional stress. It can be usually it's a bad thing. It can be something extreme like the death of a close loved one, but sometimes it can be really extreme excitement from what some people might consider a good thing. You hear about it in lottery winners sometimes, but basically what it is the sudden surge in stress hormones can cause the heart muscle to become extremely stunned and basically completely dysfunctional. Where most of the heart just stops moving and just a little tiny bit moves. It's got some scientific characteristics, but that's not really the point of the discussion, and I don't want to belabor the scientific part of it. But what is it that might show that you might be having it? Basically, it's sudden extreme chest pain is usually the first thing. It often mimics a heart attack, so it can even show some of the same EKG findings that you would find in a heart attack. And so a lot of times we find this because we take patients to the cath lab emergently to try and open up what we presume to be a heart attack, and then we see that their arteries are actually very normal, and that when we look at how their heart muscle squeezes, that it's has this characteristic appearance. And basically, what are the treatments for this? What's the long-term prognosis for this? The long-term prognosis is actually very good. Most people recover completely normal heart muscle function. If you were to do an ultrasound a few weeks or a couple of months later, it might look totally normal. But in the short term, it can be dangerous in a small percentage of people. It can lead to heart failure, frank heart failure, arrhythmias or irregular heartbeats, some of which are very dangerous. And it does require treatment usually with medications that are the same type that we would use to treat heart failure, at least on a temporary basis. I've seen this many times over the course of my career. The first time I saw it was in my training. We saw it in a woman who came home and found her young son dead on the floor. So something extremely emotional and stressful like that. A lot of times you'll see it. I'll see it a lot of times with people who've lost close loved ones. The good news is, like I say, the prognosis is very good. Usually, well over 95% of these patients recover completely normal heart muscle function and can come off of medication within a few months. Why is it that I bring this up today is because this week's been pretty emotionally stressful for me. I've had a lot of tough cases at work. I don't obviously like to talk about too much of what I do in a public forum when it comes to specifics because of obvious potential confidentiality issues. But tough cases, particularly in younger people, have got me stressed out. I'm only 41 years old, and so when I start working on people who are younger than me, that's pretty emotionally stressful for me. And the other reason is because I found out this week that we lost a couple of my old high school classmates this week, and there's a lot of stress that goes into that with people who are grieving for those people. And so if you have lost a loved one recently or gone through similar such emotional stress, please reach out to people who are around you for help, for support. Lean on your friends, lean on your family. That's what they are here for. That's what we are here for. And sometimes when you can find a little bit of a healthier outlet for your support, it might help reduce your chance of having something bad happen. But I wanted to take a couple of minutes and bring this up today because emotional stress is obviously very real, but broken heart syndrome and is obviously very real too. And I think a lot of people don't really know that that extreme stress can really hurt you in a real physical way. So I hope you'll take a minute to comment, as always, on where you're watching from. And if you have questions about stress in your own life, or just want to vent or get something off of your chest, feel free to comment in the section below. I love engaging you guys as always, and I thank you for watching. And have a great day and a great weekend, everybody.